department for COVID-like illness are down, and the COVID-positive hospital census is also down. And so this has been what we saw. We had almost 13 million Floridians that have been vaccinated. Close to over 90% of seniors have received at least one shot. Almost 85% of people over 50 have received one shot, and we're getting close to 70% of the eligible population, and we are over 70% of the adults, which is better than the national average. And of course that's been what most of the effort has been spent on since December of 2020. But what we saw was, as you started to see admissions to hospitals increase, very few of the folks who were being admitted knew about the availability of monoclonal antibodies. And so if infected, then what do you do? And some people were basically sent home, and they would hope to get better, and if they didn't and it got worse, then they ended up getting admitted to the hospital. The monoclonal antibodies, when you do it early, has a really strong track record of keeping you out of the hospital and saving lives. This has been something that even people high up in D.C. have acknowledged has been very underutilized. And so in Florida, we saw that this was not something that people knew about, so we took steps to make it more prevalent and more people have more people understanding. But we also understood, even though this had been administered since the EUA for it in both Regeneron and the Eli Lilly in December of 2020, hospitals have been doing it. There's only so much that they could do in terms of their footprint. We wanted to make sure that we had more options, and so the 21 sites we've done really throughout the state, if you look at our major population centers, it's something that is relatively within reach of the vast majority of our population. Obviously here in Northeast Florida, we have the Jacksonville site. We also have North Central Florida. We have Alachua County. If you go further down the east coast of Florida, we have Ormond Beach. We have Merritt Island in Brevard County. We have St. Lucie County, West Palm Beach, Pembroke Pines in Broward County, and Miami-Dade. If you look in that center part of the state, in addition to Alachua, you have Sumter County. We have Orlando. We also have Polk County, and then of course on the west coast of Florida, they're all up and down there. So people now have access to it, and the message is just, look, if you're infected, whether you're vaccinated or not, obviously if you're vaccinated, if you look at the data in Florida, the chance of you being admitted to the hospital is much less than if you're unvaccinated. I think it's typically 80 to 90% of COVID-positive patients, admissions tend to be unvaccinated. We're also seeing that in the mortality as well, where the disproportionate amount of mortality is concentrated in people that are unvaccinated, which that doesn't even tell the whole story, because if you look, we have almost 85% of the people that are over 50 are vaccinated. Most of the COVID mortality, of course, is over 50. And so if you have more mortality amongst that 15 or 16% of over 50 who weren't vaccinated versus the 85% by 4 to 5 times, then you could say the chances are even greater than that, that the unvaxxed would be more at risk than the vaxxed. So we see that. We also know about 90% of the hospital people admitted did not get monoclonal antibodies prior to being admitted to the hospital. And so some of the folks who were unvaccinated, obviously they would have had a better chance if they had done this. But even our vaccinated patients, you look, some of the folks who are most at risk of COVID, of course, are the most likely to have been vaccinated. So they've been vaccinated, but yet they could still get infected. I think we're seeing that. And so if you end up having a symptomatic infection and you come in and get it, that has kept people out of the hospital, and it actually has even done more. We had a family write in about a 90-year-old parent who was fully vaccinated, got a symptomatic infection, got this, did get admitted to the hospital, but was able to be discharged, and the physician said, look, had you not done the monoclonal, you probably would have gotten worse, and we may not have been able to discharge you. So there's a lot to recommend and a lot to commend on it, and we're just glad that more people understand it. We're glad we're making use of it. So we have 21 different sites. Over 30,000 folks have been helped. FloridaHealthCovid19.gov has the information on the various treatment locations. And again, it's important to point out, this is not the extent of the availability in Florida. These are just the sites that we've added to supplement what the healthcare system is already doing. Many hospitals do it. Not all of them do it every day. Most of our sites are 7 days a week, which makes it easier for people. So just understand, if one of these sites isn't convenient for you, there may be something more convenient for you. Maybe a physician's offering it. Maybe a hospital system is offering it. You can make appointment for these treatments at patientportalfl.com. You don't need a prescription because the Surgeon General's issued a standing order. And I think part of the reason why we may have had less visibility on this and less uptake is prior to us doing the standing order and setting up the sites, you had access to this, but you'd need to be referred from a physician. So if you got a referral, then you could go to an infusion center and get it. Now we've cut out that part of the process. Obviously, we're not saying don't consult with your physician. Please do if you want, but that's not necessary. And so we're looking at people who qualify under the EUA, people who have certain underlying health conditions like diabetes, cardiovascular issues, lung conditions, kidney problems, people who are elderly, and people who are overweight. Those are the categories where you're most likely to see a symptomatic COVID infection lead to hospitalization. And so if you're able to get this early, you can really make a difference. So we have with us today Toma Dean. She contracted COVID and developed 105-degree fever for several days. She was recommended to come to get at our Jacksonville site a monoclonal antibody treatment. Her mother had seen some of the reports about it, scheduled an appointment for her. She it was about 4 hours from the time she got there until the time she got home. She recently spoke with our Chief Medical Officer for the Division of Emergency Management about her recovery, but also about how well run the site was. And so we're just going to have her, I'm going to have Mayor Curry come up and formally introduce her, but she's going to tell a few words just about how this impacted her, and maybe that will be something that could help other people going forward. So Mayor, do you want to come up, and then we'll have Toma speak.
Thank you, Governor. First, I want to say it's been a long year and a half, obviously, but to have the relationship that the city has, that I have, Governor, with you and your staff and your team, to be able to get you guys on the phone, access to testing, vaccines, and now this really important treatment. Obviously, this virus is incredibly contagious, continues to spread, even with vaccinated folks, but these treatments work. I'm glad that the governor gave us access to these treatments. We can see a correlation in the decline in hospitalizations from the time these treatments became widely available to the public. It's saving lives. We've always said it's about protecting our health systems. It's working. It's doing just that. And turn it over to Toma and have her tell her story. And I'm glad you're here. I'm really glad you're here.
Very thankful. Thank you. Hi, I'm just introduced myself. I'm Toma Dean. I did receive the Regeneron treatment. First, I'd like to tell everybody, thank you. Thank you for making this available. There are some states it's not available to us in. I say us, as in people sick with COVID. So what they put in place for us, take advantage of it, go get it. I was on day 9 or 10 when I received the Regeneron treatment, and I had 105 fevers. My oxygen at home would drop to in the 70s, 80s, jump back up to 90 very quickly. I could go to the ER and they would give me fluids, and then they would send me back home because by the time they gave me fluids, I would get better. That wasn't the long-term cure. I was headed for an ICU bed. I was headed for high-flow oxygen, one or the other. There was not a doubt in my mind. You can tell by your body, you can tell by your breathing. So I received the Regeneron, and within about 24, 36 hours, I knew I was going to make it. I knew that something had drastically changed in me. I was still very sick. I still had a fever. because I had been so long, and I didn't know about the Regeneron until my mother told me about it the day prior to receiving the treatment. But that night at the ER, the doctor said to me, "You need monoclonal antibody treatment, or you're headed for high-flow oxygen or ICU bed." At that point, I started crying, and I thought I really was leaving Earth. I thought I was leaving. I have 2 kids, a mother, a boyfriend. I need to be here. The next, they got me out of the ER. My oxygen was hovering 90, 92. And I went to the Regeneron site where this photo went viral of me. And if you look at that photo and you think you're half that sick, get up today and go to a Regeneron site. Please. You need the treatment. It will save your life. It took me 7 to 8 days after Regeneron to completely recover to where I am right now. My voice is still not back completely. I still have a little bit of shortness of breath. But I can get up, I can take a shower, I can walk, I can do those things. I hope that I help somebody out there today get up. Go take your family member. Take them. Help them to get this. Please. And thank you.
We have also Cord Bird.
Thank you, Governor. Good morning. It's great to be with everybody today. And I think the message of today is early treatment saves lives. I had a breakthrough symptoms of COVID and immediately got tested. And when I was positive, went and consulted with my physician and was able to get the monoclonal antibodies. And it lessened the severity of my symptoms, kept me out of the hospital. And so this is not a disease or a virus that you're going to tough out. So really my advice to everyone is as soon as you have signs or symptoms, get tested, talk to your doctor, and get early treatment as quickly as possible, because it really, really matters, as you've heard from Ms. Dean today. So that would be my message. And thank you again, Governor, for being here, and Mayor, for all the work that you've done.
Great. We appreciate Toma coming to share her story. And, you know, look, this is something where had we not been doing this, she would not have known about it and probably, you know, wouldn't have been able to get the treatment, and who knows. I mean, so that's what it's all about. Again, this is not forced on anybody. Just like, you know, vaccines, we said, available for all. We're not going to force you, but here's what could help you. So provide information, let people know that if you do have a COVID infection, particularly if you're in a high-risk category, this is something, if done early, that has a really strong track record of resolving the symptoms, keeping you out of the hospital, and potentially saving lives. And so as we go forward in this, obviously, you know, we're glad to see trends with admissions and ED visits and the hospital COVID census going down. Clearly, Northeast Florida, you know, has had good downward movement, as the mayor said. But here's the thing. This is not going to go away. So there's these waves come, and you'll see it in other parts of the country, and we will then see different patterns here in the future. So this is something that's going to be with us. We have enough data now to look to see, and we can say that you're less likely to have a severe symptomatic illness if you're vaccinated. If you're infected, you're much less likely to have a symptomatic illness go to the stage of hospitalization or death if you get a monoclonal antibody treatment. And so those are the best tools that we have when you're dealing with this. So going forward, you know, it should just be part of the standard of care that if a high-risk person comes down with COVID, that they're immediately referred to get a monoclonal antibody treatment. And obviously, we have 21 sites operating now. Our goal would be, you know, when the time's right, to have that just folded in to the overall healthcare apparatus who know how to do it and probably could do it very well. But we'll get there. But certainly it's got to be. And if you go back from December of last year, when the Regeneron and the Eli Lilly, now you have one by GlaxoSmithKline, which got EUA a few months ago, very, very good track record. That is not something the federal government has purchased, so we can't just draw it down like we're drawing down the Regeneron. But we think that as that gets into the health system, between some of the different reimbursements from the feds and all this other stuff, we do think that will be accessible to a lot of patients within the health system as well. That's got an 85% track record of reducing symptomatic infections and preventing hospitalizations. And that's also effective against Delta. Regeneron and GlaxoSmithKline effective against Delta. Eli Lilly not as much, and so that's why people have really gone to Regeneron. What you want to do is just have that be something as a matter of course, because I think what we're seeing is the vaccines protecting against reducing likelihood of severe illness, but people are having, they call them breakthrough infections, but really people are testing positive frequently who've been vaccinated. It's not like it's something that's very rare. Most of the time that's going to be enough protection to where hopefully you'll just have a mild illness. But if you are in a high-risk group, if you're somebody who has some of those underlying conditions, people who are elderly, you may want to avail yourself of the early treatment. And so we're happy to be able to have 30,000 folks that have gotten treatment in the state of Florida with our sites. We've been doing on average about 4,000 a day across all the sites, and we obviously want to continue to provide that for as many people as we can. Okay, with that.
Governor, I got a question about your fundraising trip in New Jersey.
Go ahead.
Thank you. So Judge John Cooper ruled on Friday that your executive order on mask mandates is unlawful. How do you react to that? What are your next steps?
Well, it's going to be appealed. Obviously, it's problematic. If you look at the ruling, he's basically saying that it violated the school boards. The Parents' Bill of Rights violates the school board. But in reality, the school boards weren't even parties to the case. So I think we're going to have really good grounds to appeal in terms of the First District Court of Appeal. And look, at the end of the day, what the Parents' Bill of Rights requires, in our judgment, is that parents be given the right to opt out if they think that's in the best interest of their kids. So districts can actually have policies, but you got to opt for it, parent the right. They've basically taken away the right of parent and say you don't have any say in it. I thought about this and then thought about, what if the reverse happened? What if a district banned anyone from wearing masks? I'll bet you'd have parents sue under the Parents' Bill of Rights, say, hey, wait a minute, I think this is in the best interest of my child to go to school to wear, and you know what? I think that they would win on that. And so it'll be appealed. We'll end up getting it back, and I think at the end of the day, ultimately we're just trying to stand with the parents. A lot of parents, they know their kid in terms of the health. Parents' Bill of Rights has said this is your right here, and we think it's important that they be able to be given the ability to opt out. Good news is that if you look at where we're seeing, obviously they've increased testing a lot among school-age kids, massive increase in testing. But I think these are mostly asymptomatic and minimal cases. The American Academy of Pediatrics even came out and acknowledged that there's no evidence that the Delta is more severe with minors than the previous iterations of COVID. CDC actually in their briefing last week said, the COVID positive patients who are under 18 in hospitals is no different in terms of the proportion than it's been throughout the entire pandemic. And in Florida, it's been about 1.1, 1.2%. And a lot of those are hospitalized for things other than COVID. They're positive, but they're being treated for other things. And so, it is a low risk. It remains a low risk for students, which is obviously a very good thing. And clearly, we just want parents to be able to have their kids be in the best situation to learn and to grow and to do all the things that we need our kids to do. There was a really disturbing study that came out about, and I think it was focused on areas that had the kids locked out of school last year, but you had a massive increase in childhood obesity as a result of some of these lockdowns. And you think about it, the COVID's been roughly a flu level risk or even less than that for kids, but you see a big increase in that. That's going to have huge ramifications for people's health going forward. And so we just want kids to be able to learn in the best environment, and obviously we want to make sure parents have a say in that.
Governor,
Yes, sir.
you're criticized for going to New Jersey fundraising.
Hi, Governor. How are you? Over the past summer, we've seen a massive surge in COVID cases, but however, the last 3 weeks, we've been kind of plateauing at 150,000, 151,000. Do you think this surge is about to end sometime soon?
So here's what we're seeing on the case. It's a good question. So if you look at kind of when the 7-day average peaked, it peaked and then it's kind of just been trudging along. If you look at the cases amongst people over the age of 20, you see a clear decline over the last 2 weeks, which is obviously a good thing because those are the folks over 50 who are most likely to have serious illness. What's holding that kind of average up has been a huge increase in testing amongst people in school. It's not necessarily having more symptomatic illness, it's just detecting more mild cases. And so if you look at the graph on the number age group testing, it's a huge increase. And so I think they're detecting more mild cases, but I think if you look at the decline in ED visits, I think if you look at the decline in hospital admissions, and I think if you look at the decline in hospital census, those are really the key indicators about where symptomatic illness is. So I think as the whole back to school stuff and some of that testing goes, I think you'll start to see, I actually think it's going down in the school age kids. I just think that they're testing so much that the numbers are being held, but the percent positive I do think is going down. So, but these indicators, especially with Delta, which is very transmissible and it's something that is airborne, we really are trying to protect against symptomatic illness. I mean, that's why we're doing the Regeneron clinics. I mean, we understand that even vaccinated people can test positive. Obviously, unvaccinated people can test positive. So what do you do then? And, I think at the end of the day, that's really, so this has been helpful. Obviously, Mayor Curry said, it's tracking. As soon as we put this in, you've continued to see the hospitalizations go down in this part of the state, and that's great, and that's what we want to do.
Why are you doing out-of-state fundraising during the pandemic?
So increased cases here.
What's that?
In Duval County, at our schools, we are seeing cases increase.
Yeah, but you're also seeing testing increase, and so when you look at it, go ahead.
Well, yeah, but they're passing that on then. They may not be as serious, but they're passing that on to parents and guardians. Doctors are telling me that's the problem. That's what they're concerned about what's happening. That's why they believe that a mask would be beneficial in that, at least so the kids don't get sick.
Well, so the issue is, okay, as a kid, yes, it's mild. Thankfully, they get over it. They handle it very well. And actually, if you look statistically, elementary school student, barring any major health problems, but a typical elementary school student is at less risk unvaccinated than the average vaccinated adult, even though the vaccination's helping the adult. That's how low risk it's been for them. And so the issue is, are they then passing it along to parents? I'd say two things. One, the record's been very clear. Kids almost always get infected by adults. They are usually not the one to affect the adults. However, I would also say, if that's a concern, a parent has every right to have the kid wearing the mask to school. No one's saying you can't have that. That's your decision. I think a lot of parents would look at it and say, they're more concerned about making sure their kids do well in school than they would be worried about that. But nevertheless, every adult in Florida has had access to the vaccine since April. And obviously, we started with senior citizens in December. We've now done, I think, 4 million seniors. I think over 90% of them have gotten at least one shot. We have seen, steady increases in some of the younger, those middle-age groups in terms of the vaccine. But all parents clearly, have had access to this for some time. And we obviously, so last year with the schools, you remember, they wanted to close the schools. So we lost in Leon County last year in the trial court, won at the first DCA. The trial court ruled that what we were trying to do to open schools, they said that was illegal. We won on the first DCA. We had a school year which was instrumental in helping these kids going forward. And so we were able to do it. But when they were trying to close schools, there was an acknowledgement that this is low risk for kids at the time. They were acknowledging that, but it was all about potentially spreading it to adults. And even though there wasn't a lot of data supporting that, that was kind of what they were doing. Well, that was prior to having vaccinations. Now you have the ability for vaccinations both for staff and for parents at home. And so, my view would be parents should equip their kids to school how they want. If they want them to do mask or not mask, I think it's their choice. But I also know there's things they can do to protect themselves going forward, and I would just hope that they could do. And look, obviously open schools is so important. We were really the leader last year in this across the country. We're continuing to make sure that we have a good school year. It's very important for everyone, regardless of what you think about parents' rights. But let's not lose sight of the fact that when we're dealing with COVID, the people that are ending up in the hospital are the people who tend to be 50 years of age or older, people that do have serious underlying health problems. And so we spend a lot of time, and understandably, but sometimes we lose sight of, I think, where the major risk factors are. And so that's why with the Regeneron, that's one thing that we're able to do, and we're able to do many other things. And so I think, look, this is a good story here. We're going to keep it going. I think the community has more understanding about that there are ways that you can actually treat this, whereas for a lot of times there was not really much being done. So you can get treatment. We've expanded it. The results have been positive, but we're not even close to where we need to be. So we're going to keep it going. All right, thanks, everyone. We'll take care.
Jersey fundraising trip. You got any comment on that, going out of state fundraising during the pandemic, sir? Travel safe.